We're gonna be your buddy on the way there. Shocked. You roll up in there and there ain't a nursery in sight. That takes a long time. Lots of new parents are shocked by the same things. I see it over and over again. So let's go over 5 of them so you're not shocked too. I am a labor and delivery nurse now, but when I had my first baby, I was not a labor and delivery nurse. And so a lot of the things we're going to talk about, they actually really surprised me as well. So by the end of this video, you're going to know 5 things that seem to really surprise new parents, and then you can go into your birth experience feeling more prepared and less shocked overall. First thing I want to tell you about is that your nurse is going to come in and out of the room often, probably a lot more often than you would expect. And it's not just because I want to see your pretty face. I mean, I do want to see your pretty face, but there are a lot of tasks that we actually do that a lot of people don't know about. There's things like checking in on you and your baby, checking your vitals, giving you medications, making sure everything is going according to our plan as close as we can while you are laboring, getting ready to have your baby. And then once you do get ready to push your baby out, hey, it's this girl right here that's going to be with you most of the time as long as things are going the way we want them to go. I am going to get you to the point where you see about this much of your baby's head crowning, and then the doctor is going to come in to make sure that everything goes smoothly as your baby makes their entrance. And then once you have your baby, it's going to be me again. I'm going to be coming in and out, doing all of those vital signs, checking on your fundus, giving it a rub. Your fundus is your uterus. I'll try to be as gentle as I can. But we want to make sure that your bleeding is under control. We want to give you medications if you need them. We're also checking in on your baby, making sure they are transitioning well. There are a ton of little things that happen kind of behind the scenes that you may not be expecting, but I do want you to know that your nurse will come in and out quite often so that it doesn't surprise you. Now, if you are hoping for a less interrupted experience, definitely discuss that with your provider and then discuss it with your team when you arrive at the hospital, especially discuss it with your primary nurse. Then we can kind of go above and beyond and try to group all of the care that we have to do together as much as we possibly can. And then we can also put a little signage on the door that says minimal interruptions or quiet tone of speech. Don't be too loud. Don't throw the lights on. Just sort of be as quiet and less interruptive as we can if that's what you're into. That first trip to the bathroom comes as a surprise to a lot of new parents, and not the fact that you have to go to the bathroom. I think we are all aware that eventually your body will need to use the toilet, but more so the process of getting up and getting into the bathroom and then what's involved once you get there. So please, your first trip to the bathroom, make sure your nurse is with you. We want to be there with you, not so we can watch you have a pee, but more so to make sure that you are safe getting there. Because sometimes if you've been laying down for a long period of time and then you get up, your body might be a few steps behind and it maybe didn't get the memo, and so that can run into some trouble. Sometimes people can pass out or be quite unsteady on their feet, so we want to be with you. When you walk to the bathroom, we're likely going to be arm in arm with you right beside you, making sure that you get there safely. Some people are not aware of that, so yeah, we're going to be your buddy on the way there. And then once you get into the bathroom, getting down onto the toilet can also be surprisingly difficult because what was once a simple task now feels sort of all out of sorts. So you're going to grab onto the handrail on the side, and you're also going to use your other hand to feel the toilet and bring yourself down. Now, if you had a catheter during birth that didn't come out, or if you had a catheter, it came out and then it needed to go back in after birth, that is where this catheter is going to come out. We are going to remove it as you're sitting on the toilet. Now, there's lots of things that happen in the bathroom. We are going to help you to change all of your pads, show you how to do pericare, make sure you are feeling nice and fresh. But that first trip, it feels weird. It's a weird sensation to go pee after giving birth. I don't know why, I don't know the science, but it is just a little bit shocking. So make sure we are with you to help you through it. I have taken quite a few road trips to the bathroom. My name is Tina. I am a certified perinatal nurse, and I am a certified breastfeeding specialist. I've been doing this a long time. If you are new here, welcome to it. Please click subscribe and hang out with us even more. And if you are not new here, I really appreciate you coming back. If you didn't take a prenatal course before you gave birth, you might actually be shocked to find out how many tests and assessments and possibly medications your newborn might receive before you take them home with you. Now, there are very routine things that we do. We check in on babies' vital signs. We look at their heart rate, their breathing rate, their temperature, and possibly their blood sugar if it has been fluctuating or if they are at high risk of having low blood sugars. Very, very standard. We're also looking at how they are transitioning to life on the outside. We're looking at how they are breathing. Are they using their accessory muscles? Is their nose flaring? What's their color like? Is their cry strong? Are they nice and toned up, or are they quite loose and floppy? We look at all of those things pretty routinely. Like I said earlier, we come in and out more often than you might expect. But there are also some standardized tests that will be done for your baby before you go home. These are likely to include their hearing tests or their hearing screening. It also includes something called a CCHG, which sort of tests their heart function. Then there's also a metabolic screen, which is a heel poke because we do need a drop of blood to test it. So those are all very standardized. You can look into them more if you need more information. The other thing that people can be surprised about is the medication administration for your baby. So there are kind of 3 medications that are quite standard, especially across the US. They're going to include the erythromycin eye ointment, the hepatitis B vaccine, and then the vitamin K injection. Injection, it is not a vaccine, that vitamin K. It is used to prevent bleeding in babies. Now, I have videos on all of these, and I encourage you to look into them and discuss them with your provider if you do have any concerns or you do need more information, because remember, information is so crucial to making those informed decisions. The 4th thing on the list is that not all hospitals have nurseries. So if this is something you are banking on, I'm going to need you to check in with the site that you're planning on giving birth at before you give birth to your baby. Because if you think that there's going to be a nursery there and you roll up in there and there ain't a nursery in sight, that's probably going to be pretty disappointing, and it's going to play a pivotal role in your postpartum journey. So I know your Mima probably told you that when they gave birth to your mom, they were like, yeah, I had her and then I sent her off to the nursery and they gave her a bath and they fed her formula and I slept for 12 hours. Like, that's generally not how it works anymore, because when we know better, we do different things. I'm not going to say we do better, because those nurses and your Mima and your mom, they all did amazing things. But we do have more information now that shows when baby rooms in with their mom after birth, it's going to have increased breastfeeding rates. It's going to make you feel more successful and able to breastfeed. It's also going to have you with your baby to improve that bonding, to increase the amounts of skin-to-skin time, which we know does wonders for both you and baby. So there definitely are benefits of rooming in, and a lot of sites are moving towards rooming in 24/7, meaning your baby is always by your side, always in your room, and they aren't going to a nursery. Now, there are some sites that still do have nurseries, so again, it's something that you can utilize if it's a tool that you feel is going to benefit you. And a lot of times, yes, some people do benefit a lot from having their baby in the care of very competent people, very competent nurses, so that they can get rest and they can feel really satisfied and really safe that their baby is in good hands, get that quality rest, and then when they are with their baby, they can be more present. We made it. The last thing on the list, it shocks probably about 99% of new parents, is how long discharge takes. And this is not unique to like postpartum, having a baby, being discharged. This is hospital-wide. Anytime you are admitted and then you are discharged, like that takes a long time. And there's a lot of things that has to happen, both on the back end, on the admin side, to actually get you discharged from the system, but also from a nursing and a provider perspective. We actually have a list of things that we have to make sure are completed before we can send you home and say, yep, I feel safe sending them home. And of course, if you don't want to wait for those things to happen, if you feel like it's best for you and your family to leave before you have been medically cleared, there is always an option for you to sign out against medical advice. But I want you to know, please don't do that. I want to make sure you have all of the information that you need to be successful at home, not only in your healing journey, but also to take care of your baby now that you are all on your own. Because I'm going to hand you your baby and be like, here you go, and you are all on your own. So there is a whole bunch of things we have to check off. We have to make sure that those things we talked about for baby, that they are all done and that your baby is safe to go home and that they don't need any more medical follow-up. They also have to be discharged by their pediatrician or their provider. You have to be medically discharged by your provider as well that says, yes, healing is going well, vital signs are stable, and your bleeding is under control. We also need to make sure that your pain is under control. So we need to make sure that we give you any prescriptions that you might need. Remember, if you need more than Tylenol and Advil, please ask for those things. Then we need to make sure you have your discharge instructions, any information on any specific things you need for your postpartum journey. We need to make sure that your baby is in the correct car seat and that they are in the car seat correctly, because there are some errors that a lot of first-time parents make. You would not be alone if you need those things to be corrected. So it's definitely a process when you are discharged home from the hospital. So I want you to be aware that you can't just be like, like, "Okay, I'm ready to go home," and then 10 minutes later, you're out the door. It can take an hour or 2 or 3. It can take many, many hours. And again, regardless of where you are in the hospital, this is a thing. So always be aware, discharge takes time. If you like this one, show it some love for me. Consider subscribing so you can come back and watch even more. If you like this one, you'll also love this one right here. And as always, be happy, stay healthy, have fun. Bye.